Hi guys, my name is Yetialamidi and welcome back to Living Life, Your Favorite Nurse. So if you're new to my channel, don't forget to subscribe and join the family, and if you're one of my returning subscribers, welcome back. So today we're doing a comprehensive review about delegation, and we're going to use picmonic resources to kind of, learn the topic. So delegation, I feel like learning about it in school, I was like, oh, this is easy. I can just tell someone what to do, or honestly there's not too much I need to think about it. But on my NCLEX exam there's honestly so many questions about delegation and prioritization. I can never say that word. We're not going to talk about prioritization today, but we're going to talk about delegation. And also, in the real world, when you're actually a nurse, a lot of delegating actually goes on. So I feel like in nursing school, I was just like, oh, whatever, like, I got this. This is not a big deal. But honestly, properly delegating can actually save your license, and incorrectly doing so can harm a patient and actually cause you to lose your license. So this is actually something you need to know for your NCLEX, and also something you need to know to work as a nurse, to effectively work as a nurse. So either take notes or watch this video multiple times, but just make sure that you understand the concepts. So like I said, we're going to use picmonic to kind of just learn the theory about it. Then there are some questions that we'll do together that will kind of just help you make sure that you understand what we've learned and also prepare you for your NCLEX. So there's one thing to know. There are tasks that you should not delegate. And to help you remember that, you can remember the acronym TAPE. So you should not delegate anything that requires you to teach the patient. I should not be telling another nurse, okay, go teach this person how to breastfeed. Go teach this person how to do this with their catheter. All things teaching, I want to ensure that I've done it correctly and the patient acquires the knowledge that they need and fully understands. So I want to do that. I don't want to tell anyone else to do that task. So for the A in TAPE, assessment, I want to also ensure that all things assessment, I am doing myself. If I need to assess how the client is ambulating after surgery, I want to do that. I don't want to go say to another healthcare professional, can you go see how the client is doing after their surgery? I want to go do my own assessment of the client. Things that also require planning, so that's the P in the TAPE. I want to ensure that I've done that myself, all things to do with planning. And the last one is E, so that's evaluation. So evaluating the client, evaluating their knowledge, evaluating maybe an intervention that was done. I want to also make sure that was done effectively and accurately. I'm going to do those myself. I will not be delegating those to anyone else. Again, so remember the acronym TAPE. So that's teaching, assessment, planning, and evaluation should all be done by me. No delegation, okay? So there are 5 rights of delegation that basically help to guide you. I wrote down picmonic's definition, which I really, really love, so that you guys can understand. So 5 rights of delegation basically helps you to guide how to effectively transfer responsibilities or performance of a task to another person. So again, they're helping you understand or acknowledge, making sure that you know how to effectively delegate a task to someone else, making sure that you do it right. So it's basically giving you like the advice and the guidance. So the first right is the right task. So you're basically ensuring and making sure that you're actually delegating the right activity, the right task to do the right responsibility. So if I'm telling a PSW to go empty a patient's catheter and just measure the volume of urine that was in the catheter or in the collection, whatever, I'm making sure this is the right task. This is what I want to be done. So usually thinking about the right task, something that you can delegate, is usually something that requires minimal supervision. I don't need to watch whoever I'm delegating the task to like a hawk. It should be something that I believe they can effectively do. Also, it's something that can be repetitive, maybe something that they've done many times, something that you consistently do, like maybe asking an RPN to go take a patient's blood pressure, something that's typically consistent and not typically changing. Like I said, emptying out someone's catheter. And the task should also be non-invasive, so maybe they shouldn't be going into any holes or injecting someone, and the results should be predictable. So when I'm asking someone to go empty out someone's catheter, I'm not expecting that maybe the person has hematuria or I'm expecting to see like something crazy coming from this patient. It's very possible they've gone to go do this and they're like, oh, there looks like there's blood, I'll go and check it. But it would probably be with someone that's stable, someone that I'm expecting predictable results with, and we're going to talk about that a little bit more. But again, an example of delegating a simple task that requires supervision can be asking another nurse to go and reposition a patient. So let's move on to the right circumstance. So that's number 2. So making sure that, you know, you're acknowledging the environment, the patient, and also just acknowledging that this is the right circumstance to delegate. So when I think of circumstance, I'm thinking like, is this patient stable? So maybe I just got someone who just came out of surgery, they're like 1 hour post-op. I will probably not delegate. Actually, let me just say, I shouldn't delegate any of their assessments post-surgery to anybody else, because this person can be unstable. They just came out of surgery. Maybe I had a patient on the unit for a couple days. They're like maybe 4 or 5 days post-op. Their vitals have been stable, labs have been stable, they're healing well. Maybe intervention or a task that I needed to be done could be delegated to another healthcare professional because they appear to be more stable. I'm expecting the results that I'm going to get, or that they're going to get, to be a little bit more predictable than maybe someone that just came out of surgery. Maybe their SATs are low, maybe they're bleeding from somewhere. Many things can be happening. So I want to, you know, keep an eye on my patient. I don't want to be giving out any responsibilities to somebody else. So now the next right is the right person. Am I actually delegating this task or activity to the right person? Should I be delegating this responsibility to an RN? Is this something that is within the scope of an RN? Am I delegating this task to an LPN or an RPN? Is this within their scope, below their scope, above their scope, in their scope? Or am I delegating this task to a PSW? I would not be delegating teaching to a PSW. A PSW has their job to do, and it's not in their scope to be teaching. Definitely, originally, you can do a lot of teaching to the client, and, you know, maybe encourage the PSW, oh, just encourage them to eat and things like that. But I'm not giving the responsibility to the PSW to be teaching about nutrition or why they need to eat this. Like, I'm not telling them, okay, I need you to go teach the patient all about this. Again, I would do the initial teaching, but you can also, you know, tell the PSW, can you just, you know, remind them to eat this here and there. But example, that is something out of the scope of the PSW. So I wouldn't be delegating that task to the PSW. I may ask, can you please go reposition this patient on their left side? You know, that is something within their scope. You know, putting the pillow under the patient, turning them over. And, you know, that's something that they can do. Again, there are many other things that they can do, asking them to feed the client, do many other things. So again, you need to think exactly about what each healthcare professional can do. All of them can do wonderful things, but some things are just out of their scope. So that's something that you have to think of. And areas where people can maybe lose their license is delegating incorrectly to the wrong person. Yes, you may be busy and you might have a lot of things going on, but you really need to think about who you're delegating to and what you're delegating, and if it's something they should be doing. So the next one is right direction, right communication. Basically, when I think about these two, picmonic really helped me to remember thinking about the 4 C's. So you want it to be clear, concise, complete, and correct information. So you want to make sure it's clearly outlined what you want the person you're delegating to do. They shouldn't be like kind of guessing what you want them to do. They should have like straight facts, exactly what you want them to do. They fully understand. Definitely they can always ask you questions, but it shouldn't be a guessing game. So the example I kind of just said, but I'll use it again. So asking a PSW, can you please reposition patient 562 in room 1 on their left side? So I've given the room, I've given the patient, I've given what I want them to do, so that's reposition, and I've even given them the side that I want them to go on, because maybe like the patient will reposition them on their back, reposition them on an area that I don't want them to be on. Maybe they have a pressure ulcer on their back. So I'm letting them know I want them to be on their left side, I want them to be repositioned, I'm telling you the patient, and then I'm also telling you the room. Instead of saying, can you go reposition Sam? First of all, who is Sam? you know, like, who is this person that you're talking about? There could be so many people with the name Sam on the unit, so I'm giving them their actual, let's say, like, reference number or ID. You could still give name, but at least if you're going to give first and last name or something, just be really specific with the person. I'm also now giving them the room. I'm not just asking them to look around for patient 562 or whatever, or for Sam. I'm telling them where they need to go. Again, I'm telling them what to do, and then more details of what to do. So that would be the left side. Not making them guess. Does she want them on their back? Does she want them on their tummy? Does she want the bed up? Does she want, like, all those type of things? Again, they can still ask questions, but at least I've tried to be as clear and concise as I can. So the last one is the right supervision and evaluation. So just making sure that you've evaluated, making sure that the person, you know, has done an okay job, or that the person has even done the job. Because you can delegate something, imagine at 7:30 a.m., you're busy all throughout the day, and then your shift is done and you go home. And then someone the next day is like, so this wasn't done. Why wasn't it done? And you're like, oh, I delegated it. They don't really care that you delegated it. You did not go and evaluate or monitor to make sure it was done. Yes, you're not actually doing the task, but because that task was assigned to you and you're still responsible for it, you have to still monitor and evaluate and make sure it was done. If it wasn't done correctly, you need to go and fix it. You can give feedback and be like, oh, next time, can you please do it this way? Or ask them maybe to redo it if they can, or go and do it yourself. But you can't just say, I delegated it, it's off my back, it's done, it's gone. It's still your responsibility. So you still have to supervise and monitor. Okay, let's do some questions. So I'm hoping that I can post these questions somewhere along this frame, but if not, I am so sorry. So I'm going to read out the questions that I have, and I'll give you guys a second, and then I'll put up the response and we can talk about it. So, as a registered nurse, which task below should you not delegate to an LPN? So LPN, RPN, in Canada, registered practical nurse. So let me read the question again. As a registered nurse, which task below should you not delegate to an LPN? So A, performing an assessment on a new admission. B, collecting a urine sample from an indwelling Foley catheter. C, developing a plan of care for a patient who is admitted with Guillain-Barré syndrome. D, evaluating a patient about how to monitor for side effects associated with warfarin. E, auscultating lung and bowel sounds. F, starting a blood transfusion. G, administering IV morphine 2 milligrams for pain. And H, providing wound care to a stage 3 pressure injury. That was a lot of questions or answers. So you guys can pause and we'll go over the answers. Alright, so the answers are A, C, D, F, and G. So these are all out of the scope of practice for an LPN or an RPN. Remember, anything that deals with assessments, educating, evaluating, developing a plan of care, IV medications, unstable patients, or invasive/complex procedures where there's unpredictability, the RN is responsible for doing it. And these tasks can't be delegated. So the ones that the RPN can do is B, collecting the urine sample from an indwelling Foley. You know, that's stable, that can be done. They can also do E, so that's auscultating lung and bowel sounds. That's something that they can do. It's repetitive. We don't expect, anything wild to happen after that. And they can also do H, so that's providing wound care to a stage 3 pressure injury. Okay, does that make sense to you guys? I hope so. If it's not, maybe review the question and see like where you kind of messed up or what you missed. But if you use kind of everything we spoke about, you should, I would hope, be able to get that question, which is why I chose that question. All right, so next question. So on your unit, there are 2 RNs. One is a new RN, while the other is an experienced RN. In addition, there are 3 LPNs and 2 nursing assistants. Which tasks delegated to one of the nursing assistants by the new RN need to be re-evaluated? So A, applying hydrocortisone cream to eczema on skin after giving a patient a bath. B, assisting the patient with administering a fleet enema. C, emptying an ostomy bag. D, collecting and recording a patient's blood pressure, heart rate, basically getting their vitals. And E, a patient ambulating. So assisting a patient ambulating, sorry. So we're asking here, what was incorrectly delegated? So the answer here is A and B. So option A is a task for an LPN or an RN. So cortisone cream is a medication and the nursing assistant can administer medication. So option B is a task for an LPN or RN and it is a procedure. For some reason, I don't really like that question, but we'll move on. So this one is an easier one. So when delegating, you know that as an RN, you must follow the 5 rights of delegation to make sure you are delegating properly. Choose any response that is included in the 5 rights of delegation. So A, right credentials. B, right direction and communication. C, right supervision. And D, right experience. So we know the answer is B and C. I hope we know that if you don't rewatch this video. Right experience, that just sounds like you're having fun. And right credentials, no. You want to make sure it's the right person, but it's not right credentials. Or, anyways, it's just not. So true or false, so next question, true or false, an RN delegates to an LPN to administer a scheduled tube feeding to a patient. The RN has now transferred full accountability to the LPN for the task getting done, and the RN is no longer accountable for the task. True or false? So if you remember what we talked about, because I think I stressed it, you would know, but if you don't know, that's okay. The answer is false. So the RN can delegate this task to the LPN, but the RN is accountable for the task getting done, even though the RN is not the one performing it. So I kind of said that before, that like, although I might be delegating it, the responsibility is still mine and I still need to make sure it is done correctly. Alright guys, so that was kind of our little review. I would love to say a comprehensive little review of delegation. So just remember that delegation is important. It's not something that, you know, you just sweep under the rug and it's like, I know what to do. Definitely reflect on it, think about questions, answer questions, just so you know for your NCLEX, because when you want to pass, but also because this is actually something that you truly use in the real world as a nurse. So you actually, you know, need to think of the safety of your patients and also the safety of your license. So it's not something you want to take lightly. So if you want more information about delegation and all other NCLEX topics, definitely you can register for Picmonic. You can use my affiliate code, which I will put down below. But basically, they're just so helpful when you want to learn something quickly, something fast, and truly understand it. So I will see you guys next week. Thank you guys so much for tuning in. Good luck on your NCLEX or exam. I will see you guys next week. And thank you for tuning in and keep living life from your favorite nurse.